So first of all, thank you so much for taking our time to be with us on Facebook Live. I know these are tough times, not only for us in India, but also for you guys managing all the COVID patients in your country. Uh, we've been facing uh, a, a lot of challenge when it comes to managing COVID patients in our country for the last 15 odd days. Things have just gone berserk. uh, really tough. People are losing their loved ones. So I thought this would be a great time to have you uh, join us in sharing, some trusted information, because we're getting a lot of information on WhatsApp groups as well as on social media. But the challenge is we don't know what to trust, what to take seriously. So we have a couple of questions that we've got from people who uh, have been in touch with me for the last day or so. So we are going to take those questions first, and then we're going to open up for our audience to ask whatever they want. So for the benefit of everyone else, let me share with you a little bit about Dr. Ahuja. Dr. Jaspreet Ahuja is a pulmonary as well as an intensive care physician who's been managing COVID patients for the last 1 year, and has really been doing some great job in Los Angeles in the US, to an extent that he recently was awarded with the, what was that award, Dr. Jaspreet?
Turner Award.
Turner Award for some work, some exemplary work that he's been doing in the times of pandemic that we've seen in the last 1 year. So without wasting too much of time, Dr. Jaspreet, I know you are in a rush as well. Let me begin with my first question.
Sure.
What exactly is this second wave of COVID that we are seeing, and how different is it from the first one that we saw or experienced in 2020?
Thanks, Harbinder, for having me. It's a pleasure, and I'm happy to help. This pandemic has been obviously very painful, to say the least, and it's taken away a lot of our loved ones, and we are all seeing a big second wave in India. I think the major difference between the first wave, which we saw in India, and actually very similar situation here in the US as well, is that the sheer number of overwhelming, the medical infrastructure, the sheer number of patients, and what's also more distressing is the younger patients who are being more sicker in this wave is obviously extremely distressing. So I think the major difference between the first wave and the second wave is the number of patients and the overwhelmed medical infrastructure. Also, we are seeing, for some reason, much more morbidity, meaning more people getting sicker for a long time, as well as mortality. And our resources are overwhelmed. I want to reiterate, this is not due to more testing. This was a big misconception amongst everybody, that maybe the second wave is that because we are doing more tests. It's actually not true. We are still not doing enough tests, and our positivity rate in some major cities in India, actually including Delhi, is greater than 30%. So obviously this virus is really wreaking havoc all over India. I think probably one of the reasons is that when an area relaxes precautions, eventually the effect will take place over a month. But the surge also depends on the behavior of the people. They were in a lockdown for a very prolonged period. Things started opening up. We loosened our guard, and I think that's one of the other reasons why the second wave is coming.
Yeah. Dr. Jaspreet, there's been so much of fear in the minds of people that even when someone starts coughing or has fever, is it safe to assume that it could be COVID-19? or how soon should we go in for a test for confirming this?
So, good questions. I think in this time and the atmosphere, especially in India, how things are, I think if you're having consistent fevers, probably for a few days, and the fevers, I would, I would, you know, determine. I would say that the fevers means 100.4 or greater. So, if you're having consistent fevers for 24 to 48 hours, if you're having typical symptoms of COVID like body ache, uh, feeling fatigued, having a dry cough. These are all very indicative of COVID. And my recommendation at this time is that if you do start feeling and having these symptoms, the first thing to do is immediately self quarantine. Don't try to, brush it off as that's just another flu. I think just start being mindful, start being uh, very cautious about quarantining yourself and assuming that you do have COVID.
Cool. Now, once the person has been confirmed as a COVID patient, what are the things that the person needs to do? What should be the next course of action?
Sure. So, no, I'm sorry. Coming back to your previous question, when should you get tested for COVID if you think you have COVID? My assumption, my recommendations are that if you're just starting to have fever, panicking and going directly for a COVID test is not going to change anything. You have to monitor your symptoms at least for 2 to 4 days, depending on how severe your symptoms are. As long as your, oxygenation, when you check your oxygenation, as long as your symptoms are able to be managed at home, try to wait at least 3 to 4 days before you go for the COVID test. And the reason is because the way the COVID PCR tests are designed, it takes at least 3 to 4 days for the virus to start shedding and becoming positive on the regular tests. So that would be my recommendation. Now,
Got it.
coming back, can you repeat your last question? I'm sorry.
Now,
Because
once a person has been confirmed as a COVID patient, what is the next course of action? What should the person start doing immediately?
So I think the first thing is obviously not panicking. The majority of the people, the majority of the healthy people will actually just do fine. It will be a bad flu, maybe. They might have some fevers, they might have some body aches and things like that. But the key is not to panic. Uh, Start monitoring your symptoms. Start monitoring your temperature. If your temperature is consistently above 100.4 degrees, just routine medications, supportive care like crocin, paracetamol, Tylenol, those kind of medications are the key. Make sure that you're well hydrated. Make sure you have enough resources that you can self quarantine at home. Those are the first steps to do. The second step would be obviously to self quarantine, avoiding outdoors, continuing to follow masking and general hygienes, because you can still be contagious to other people. And till you've not confirmed, I think that regardless, saying masking is very important. Following general hygiene, following health department recommendations. Every state, every city has their recommendations, so following those are very important. The other thing I would advise is to get a simple pulse oximeter. It's usually available in all the stores, general stores, even pharmacies back in India. So start procuring those. Check your oxygen level 2 to 3 times a day. And those are the major things that you need to do till you know more about how your symptoms are going. Obviously seek help of a healthcare practitioner. Luckily things are still okay to it's still accessible healthcare. You can reach out to your primary care physicians, ask for advice. I would strongly suggest you do that.
Got it. Dr. Jaspreet, one of the challenges that we are facing in India is the shortage of medicines. And specifically, medicines like remdesivir, uh, tocilizum, the steroids. Now, does every COVID patient need these medicines? What are the indications that suggest that the patient needs these kind of medication?
So absolutely not. Not everybody will need remdesivir. Not everybody will need tocilizumab or even steroids. There's a lot of medications which are out there. I would say that majority of the patients, 90 to 95% of the patients, will be just fine with just simple supportive measures, controlling their fevers, controlling their symptoms. The things, simple things like crocin, paracetamol, those are going to be the mainstay of treatment, just supportive care, symptomatic treatment. These medications, especially remdesivir and tocilizumab, are only to be given under a physician supervision, ideally in a hospital or a healthcare setting where you are monitored. Uh, and I'll be happy to go over the indications of all of these medications, but I want to reiterate, most of the patients will do just fine by monitoring their oxygenation, monitoring their symptoms. It's going to be a couple of tough 2 to 3 weeks. That's usually the course of the disease. But like I said, most of the people will be just fine monitoring and controlling simple supportive care at home. Now, medications like remdesivir, it's basic. So what is remdesivir? Remdesivir is a simple antiviral medication. It was initially approved and developed for Ebola, but secondary to the structure and the properties, it was tried on medication on patients with COVID. Uh, it is not it has not shown to prevent mortality, meaning that it will not prevent death. It will shorten your course and decrease your symptoms. It will hopefully decrease your viral load, and it will help. It has shown to help people not to require more invasive forms of oxygenation, including uh, high flow nasal cannula, non-invasive ventilation like BiPAP, or even a ventilator. So these are given under in a hospital setting or a healthcare setting. They have to monitor your kidney function test, your liver function test. So obviously these all things we have to be very mindful about. Medications like tocilizumab, I've seen, I'm still getting a lot of patients calls from India asking if they should start procuring tocilizumab. I would say absolutely not. Tocilizumab is usually the last resort. It is only to be given under direct supervision of a physician in a healthcare setting. Tocilizumab is given on patients who are either on a very high flow of oxygen or on non-invasive ventilation or invasive ventilation, basically on a ventilator or on a BiPAP. Tocilizumab is given with specific indications where your inflammatory markers are high and you are still doing poorly despite all the other treatments. So tocilizumab is usually the last resort. It has not again shown to decrease mortality, which is very important. It does not decrease mortality, but it improves your chances of surviving that hospitalization. Um, Things like steroids. Now, steroids are something which can be given at home, but again, I would suggest discussing with your physician first before doing it yourself or starting yourself on steroids. And the reason I say that is because steroids are only indicated when your oxygenation is low. And I'll go over the oxygen parameters, but if your oxygen is consistently below 92, then I think you do need steroids. Other medications which are obviously very common and you've seen a lot is heard a lot about is ivermectin. Sadly and surprisingly, it is not an approved treatment anywhere in the US. Very little data to support the use of ivermectin. Not very supportive data, but people have been using it. I would say again, discuss with your primary physician or a healthcare physician and ask if ivermectin is indicated. In US, this is not indicated. It is not an approved medication.
Okay. I think that would be very, very useful for people because people have been struggling to get these medicines. And tell me one thing: is it beneficial to take inhaled steroids in a nebulizer? Is there any contradiction for that?
So, again, very good question. I'm seeing a lot of nebulizers, patients asking me if they should be on nebulizers. So I think the importance is two things. One is the nebulizer machine is just a machine which, in which you put the medication and you inhale that medication. There are two major types of medications which people are using for inhalation. One is called the budesonide, or an inhaled corticosteroid, which, I think in India it's known as Budecort or something like that. So the budesonide itself is, primarily it's an inhaled steroid. So it is used to decrease inflammation in, if you have symptoms of bronchitis, if you're having a very typical cough of COVID, where you're having this dry hacking cough. Uh, there, the inhaled corticosteroids, the budesonide or Budecort, is used. The other medication is called salbutamol. Salbutamol is a bronchodilator, meaning it relaxes your airways. So it is usually used in patients who have having a lot of bronchospasm symptoms like asthma, wheezing. So those are the people who would benefit from salbutamol. So I think you have to know what your symptoms are. You have to discuss with your healthcare physician, and decide which one is better than which one is indicated in your case versus the other one.
Cool. So,
I'm seeing
Saurabh,
I'm seeing a few questions
yeah, I was
coming
just going
in
to,
about this.
tell them that, Pankaj, Saurabh, are hi. So everyone, we're going to be taking each and every question that you're posting here uh, at the end, because I've got these questions already sent to me prior. Uh, Specific to India, Dr. Jaspreet, since you're an Indian, you would know what a homemade kada is. A lot of people are suggesting that we should take kada, and does it really work? And how, if it works, how frequently do you suggest someone should be taking this Indian concoction called kada?
So if you look at purely medical terms, none of these have been studied. So we really don't know if they really work or not. These are all, the homemade remedies, the homemade so-called nuskes, which are supposed to be working. Uh, from a real medical perspective, I don't think there's any harm to you do it, but I don't know if there's any real benefits to it. If it makes you feel better, if it if it gives you some symptomatic relief, absolutely do it. But if it's not doing anything, there's no need to torture yourself with horrible tasting concoctions, and especially try not to drink extremely hot karas, because that can actually cause more harm and irritate your airways, irritate your upper airway much more. So I think just be mindful, and not to do anything you see on WhatsApp or forums. I think just do your research before doing it. Like I said, we don't know if it's helpful or if it's not helpful, but if it's giving you symptomatic relief, I say go for it a couple of times a day. I don't think can harm you.
Got it. Got it. Now, the other challenge that we are all facing in India is the supply of oxygen. Now, when does one need the oxygen support? I mean, what are the levels below which uh, we would definitely need to have oxygen support?
So, a normal oxygen saturation is anywhere between 94 to 97%. So once your oxygen saturations are going down, it's obviously, alarming, something you need to, look out for. I would suggest that patients who have confirmed COVID or have very symptoms similar to COVID should certainly check their oxygen saturations anywhere between 4 to 6 times a day. Make sure the saturations are above 94, and as long as they're above 94, it is okay. Once you start seeing your oxygen levels dropping, I would say that yes, now is a time to probably start looking for resources to get either an oxygen concentrator at home, or obviously seeking out help from your medical provider to see what next steps would you should do. Certainly, once your saturations drop below 90%, you should be started on supplemental oxygen. Usually the initial starting point is 1 to 2 liters of oxygen flow per minute, either given by an oxygen concentrator or oxygen cylinder. I've seen a lot of cans of oxygen. I think they're totally useless. They're very, very temporary. And, those cans with a spray, I don't think those work. If you really need oxygen, you either need an oxygen concentrator or an oxygen cylinder to provide you oxygen. Once you start seeing your oxygen levels are dropping, I think very importantly, you should start working on breathing exercises. You should start working on keeping yourself prone. I'm sure everybody has heard about, what a prone position is. Basically, is that you lie flat on your stomach and try to kind of open up your lungs. What proning does is all your lung tissue kind of tends to collapse on each other when you're sitting up or when you're lying down. So when you prone yourself, because of the gravity, those dead portions of the lung kind of start opening up. We call it recruitment of lungs, where your lungs kind of open up more space for your blood to be oxygenated a little better. And a lot of time, even in front of me, a lot of time patients tell me that their oxygen saturations really shot up significantly when they're proning. The duration of proning is another question where people ask, how many hours do I need to be prone all day long? The simple answer is the most you can do is better. The more you can do is better, because your lungs are gonna keep recruiting themselves. The key is to rotate your body around so that you have moving all your body. It's not like you're just sitting in one position. The key is not to just sit in one position. Try to keep rotating around. Try to be a little active around the home, not be bed bound all the time. If you have the energy, try moving around. And obviously keeping up your oxygen levels in check. If they're rapidly dropping, or even if it's supplemental oxygen, your oxygen levels are not going up, obviously this is an indication that you need to seek medical help, probably go into a hospital, and be under the care and direct supervision of a hospital, basically.
So so that's my next question. When do you suggest the patient must be taken for hospitalization? At what stage do you think that it is important to get patient into a hospital? Because we have no
So
beds available here. ICU beds is a separate thing, but even basic hospitalization is becoming a challenge in the city.
yes, and it is very scary. I think once your oxygen levels consistently drop below 88 to 90%, I think that is an indication that and 88 to 90% despite being on oxygen. If your oxygen is 90% and you are on oxygen and your saturations go up to like 92 or 94, that's good. You can monitor yourself at home. But at the same time, you have to be mindful that sure, your oxygenation is getting better, but are you short of breath? Are you able to talk in full sentences? So if you're symptomatically not getting better, obviously seek help and try to get into the hospital. Try to go into the emergency room and get yourself evaluated. If your oxygen is consistently 88 or below despite being on oxygen, that is again an indication that you need to go into the hospital and be monitored in a more closer setting, in a more closer observation setting.
So, what are the risks of clots in COVID? I believe we are prone to getting clots during this disease.
So this has been a lot of back and forth still about the risk of clots. Most of the data which is coming out is still suggesting that you have a higher risk of clots when you get COVID. Now the key is, what do you do about avoiding clots? I think if you're self quarantining at home, the important thing is not to be sedentary, meaning not to just keep lying around, keep walking around. As long as you're walking around, your chances of clots go down significantly. A lot of physicians, including myself, has been recommending simple baby aspirin to be taken at home for a couple of weeks, as long as there is no contraindications. I think I would suggest that. Now, stronger medications to prevent clots, very commonly called as blood thinners, like enoxaparin or Lovenox, which people have heard, those are usually reserved for hospital use when patients are in the hospital, because if you have COVID and you are in the hospital, your chances of having clots or venous thrombosis are higher. So those are the medications which are given in the in the hospital, and those should be monitored there.
Cool. In while answering the last question, you also spoke about breathing exercises. So, what are the kind of breathing exercises that you recommend for COVID patients?
So I think obviously the prone is, I would consider it one of the breathing exercises where you prone yourself. The other breathing exercises are there's commercially available respirators, which we also call as incentive spirometers, where there are a couple of balls in a chamber, and you suck in the air and you blow out the air. Those are very good. If you don't have that, you can do simple things like taking deep breaths, holding your breaths for 4 or 5 seconds, and letting go. So those kind of breathing exercises are helpful to improve your oxygenation, are helpful to improve the collapse of the lung, which is very normal in people. We call it as atelectasis. I think those are the breathing exercises. The frequency, I would say, is to do it as much as you can, but don't overdo it that you feel overwhelmed at the same time. The simple spirometers or the respirometers, usually, you can do it every hour or every 2 hours for 5 to 10 minutes, as long as you're comfortable with that. I think those are good things to do.
Mhm. Uh, in India, there's a lot of information which is doing its round on WhatsApp groups and on social media. And one of the things that people are recommending is taking steam. So, they're saying that it could prevent virus. Is it true?
For my as per my expertise, steam is very similar to the homemade kadas, and the reason I say is that these are all anecdotal, basically meaning that it's going from one person to another person. No one really knows its effectiveness. One thing for sure is that taking steam does not kill the virus. I wish it was that simple, that you take steam and the virus gets killed. It's not true. Sure, you can get some symptomatic relief because it's humidified, it's warm, in temperature, so it kind of soothes your airways. So if that is the reason you're doing a steam, that's fine. Don't do thinking that it will kill the virus. It will not kill the virus. It will only give you symptomatic relief. These are all very simple, things that you can do to help symptomatically feel better, but it will not fix the COVID virus itself.
Got it. Got it. Now, there is also a lot of confusion on the effectiveness of vaccine. Initially, it was felt that the vaccine would prevent COVID to a very large extent. And then when people started getting COVID despite having the vaccination, it is being said that, it is just building your immunity so it doesn't take you to a point where, it's a question of life and death. What is your take on this?
So I still think vaccines are extremely effective. Vaccines are a game changer. They will be the light at the end of a very long tunnel. There's no doubt about it. The issue here is the vaccine efficacy and the number of people vaccinated. So the first thing I would like to discuss is the vaccine efficacy. The vaccines currently available in the US are, the Moderna and the Pfizer, which are mRNA-based vaccines, and they work in a different, mechanism of action. Their efficacy is said to be anywhere between 85 to 95%, depending on, if you go look at the different studies, as compared to the vaccines which are currently approved in India, including the Covaxin, if I'm not wrong, and the Covishield. Their vaccine efficacy to prevent to get COVID is around 65 to 75%. Again, in different studies, there are different numbers, and I might be a few percentages off. But I think the most important thing to take out of all those vaccines is that despite the efficacy being high or low, the chances of you having a severe illness with COVID, possibly requiring hospitalization, is significantly low. In preliminary studies, 100% of the patients, and that is 100% of the patients, which is an amazing feat. 100% of the patients getting those vaccines did not progress to hospitalization or death, which was amazing, which was, it's a big turning point. You will hear a few cases, someone got very ill and someone got, even despite getting vaccine. But the rule, the usual thing which we're seeing patients who are being vaccinated is the hospitalization chances of them being very low. Now, with the 65 to 75% efficacy, we have to be cognizant that 25% of the patients can still get COVID, and the people who are already vaccinated can get COVID. And it is not an odd thing, it is a very expected thing. There's a lot of vaccine misinformation, and I think it's very important to discuss this point, that people can still get COVID, but their chances of progressing to a hospitalization or a severe illness are much less. So my recommendation is to strongly take this vaccine whenever it is offered to you, and complete the course as per whatever the local and the vaccine provider manufacturers recommend, to take that vaccine as soon as you can. Now, people are asking me, why aren't we seeing this kind of spike in US, and why are we seeing this kind of spike in India? And I think it has a lot to do with the vaccine numbers. In India right now, from the last data I received, only less than 2% of the population is fully vaccinated. So obviously we will be seeing this spike. I don't think this is any surprise that we're seeing a spike, because the number of vaccinated people are significantly less than compared to other places. Like, for example, I think UK is around 20 to 30% vaccinated fully, both the two doses, and I think US is around 25% currently. So the sheer number of people who are not vaccinated, I think is certainly very much a contributing factor to this second wave.
Got it. Now, there's also a confusion. Initially, when the vaccine was launched in India, they were saying that the gap between the first vaccine and the second dose is about 28 days, right? And then suddenly they changed it to 2 to 3 months. Which one is correct?
So this is a very tricky question, and this is where the logistics probably play a role. The vaccine manufacturers play a role in telling what is the indications. The indications for the US vaccines are very straightforward: 3 weeks for the Pfizer and 4 weeks for the Moderna ones. The recommendations in India are changing. It doesn't necessarily make the vaccination program ineffective if you take the vaccine 6 to 8 weeks gap. But I think the key, and I'm not sure, I might be wrong, that it might be a reason that because of the vaccine availability, they want to give the first vaccine to as many people as possible, and that's why they're kind of spacing it apart. But as long as the manufacturers are confident in saying that it can be taken 6 weeks apart, I think that should be okay.
Okay. Now, is this vaccine advisable and safe to be taken by general population? And
absolutely.
Also, is there a minimum age that you need to achieve to be able to get this vaccine?
So the vaccines which are currently available in India are approved for patients who are 18 years old and above. So there is no, there's obviously the minimum age of 18, but as long as you're 18 above, there are no major contraindications for people not to receive these vaccines. Some of the patients who have rare blood disorders, they're advising to use it with caution. So obviously discuss it, with your primary care provider if you have any questions regarding, particularly if you can take the vaccine. But as a general rule, it is very safe, very effective. There's a lot of miscommunication, a lot of misinformation going on about increased risk of blood clots. I do not think this is true at all. I think you need to take this vaccine as soon as it's available for you, because that is the game changer. That is the only thing which is gonna put an end to this pandemic. The risk of blood clots are extremely rare. I think the one with the most blood clots, which was briefly paused in the US, with the Johnson and Johnson vaccine, and that had 6 cases out of 6 million people, which is very, very negligible, and benefits, way outweigh the, risk of getting a clot. So, whatever vaccine is available, either Covishield or Covaxin, take it as soon as you can.
Now, what about people who have recovered from COVID? Can they take the vaccine? And is there some recommended gap between your recovering from COVID and you're taking the vaccine?
Yes, so absolutely, there are specific indications and guidelines on patients who are recovering from COVID, who have COVID. People who have recovered from COVID, especially if they received convalescent plasma as a treatment for their therapy, the advised time to get the vaccine is at least 90 days after they received the positive first COVID PCR test. So those patients should ideally wait for 90 days before getting the COVID shot. Patients who have recovered from COVID and are doing well and are out of the quarantine requirements can also get the COVID vaccine as soon as it's available for them. So there's no real 90-day wait period for them. And the patients who have active COVID, and I'm hearing a lot of patients who have COVID and had the first COVID vaccine, and a week or 10 days later got COVID, and now they're asking me, should we take the COVID vaccine? And my recommendation to them is that once they've recovered from COVID, not while they're actively in COVID, obviously, because they've been the quarantine requirements, they should take the vaccine once they've recovered from COVID. And once their quarantine is over, they can go ahead and take the second shot and complete their course.
And tell me, Dr.
And I'm sorry,
Ahuja. Yeah.
sorry. So one more thing which I'm actually hearing also about COVID vaccine is it safe to take during pregnancy? And obviously the concerning thing is that this vaccine has not been studied in COVID patients, but little data we have on patients with pregnancy who are pregnant or lactating, it is okay for them to get the COVID vaccine as well. And a lot of societies, including the obstetrics and gynecological societies, is strongly encouraging these patients to receive COVID, because outcomes for patients who are pregnant and having COVID are very dismal, and obviously 2 lives are at stake. So they are recommending for people who are pregnant to get vaccine as well.
Awesome. Now, Dr. Ahuja, what are the kind of challenges? Because what we've heard is that COVID is really, really bad for people who have diabetes, people who are suffering with hypertension, or the cancer patients. What do you suggest, or what is your take on this?
So yes, absolutely. And this is, we have seen in our clinical practice also, is that patients who have comorbidities, meaning other medical problems, specifically diabetes and hypertension, and no one really knows the reason, but most obvious reason is that these patients are at high risk because at baseline their body inflammation is higher than the general population. So they tend to do more poorly because their immune systems are little compromised because of medical problems like diabetes. So these are at higher risk of getting more complicated course of COVID, having more requirements, chances of having more requirement of oxygen. So these patients should be very mindful of, the general hygiene and universal masking, not doing unnecessary trips outside the house, and trying to be very mindful of all these things, because they are at higher risk to develop more complications. Patients who are cancer patients who are on chemotherapy, their immune system is also very compromised because of the chemotherapy or just because of the cancer itself. Cancer also puts you at a higher risk for developing clots, and the COVID and cancer combination probably puts you at a more higher risk for clots. So these are the patients who should be very careful about taking care of themselves. If for some reason they get COVID, to monitor their symptoms more frequently, and seeking medications and medical help as soon as you can.
Can you share with us a little bit more about the different variants of COVID that we are seeing today, and what are their effects?
So the variants we are seeing basically are certainly concerning, because there are different variants coming from different portions of the world, different portions of the country, uh, and probably one of the reasons why the vaccine efficacy kind of drops in these patients is because the way the virus is mutating. The mutation of virus is not surprising. This is what all the viruses do, is to survive, they mutate, and they find a way to, or a mechanism to grab onto the host body more effectively. The variants currently in India, the Brazilian variant or the UK variant or probably the US variant, are still prevalent in India, and obviously decreasing the efficacy. I think the most important thing is that it does decrease the efficacy of vaccines. But again, if you did get the vaccine, the chances of you having a severe illness due to COVID are less. So absolutely, that is the reason why we still suggest that even if this is a new variant, your vaccine will still provide you some immunity, still provide you, some fighting ammunition to fight this COVID, and your chances of getting a severe illness will be less.
What are the different tests that are there to confirm, whether you are COVID or not, and other tests that are there which you need to undergo during this disease or this situation? Can you tell us more about that?
So, there majority of the tests, the diagnostic tests, are two kind. One is the antigen test, which we also call as a rapid test, and the other is a PCR test. The antigen test is very sensitive, meaning that if that antigen test is positive, most likely you have COVID. The PCR test is very specific, meaning that if you have that positive PCR test, for sure you have COVID. So PCR test is a much more reliable test, but it usually is longer process. So your results come maybe in a day or two, or depending on the current situation in India, much more than that. The antigen test is much quicker test, and those are the two tests to diagnose COVID. Now that there's a third kind of test called the antibody test, meaning that that test does come back positive if you have been exposed to COVID. Now, bear in mind that that test will not come positive if you had a COVID vaccine. And the reason is that the kind of antibodies that test generates after your body generates after a vaccine are very different and not detectable by normal testing. So the antibody test, a lot of people have said that, okay, I got my COVID vaccine 2 weeks later, I got my antibody testing and it's not positive. That does not mean that you don't have antibodies. That does just mean that the simple antibodies they tested for, you don't have that. But the COVID vaccine does provide antibodies, and those are not detectable by routine tests.
Got it. Now, typically after 15 days of COVID, when there are no symptoms that you see, do you think it is still required that you need to go and get an RT-PCR test done again?
So, I think it depends on a lot of factors. A lot of, employers and a lot of places would require you to get a RT-PCR test after you've recovered. The recommendations by CDC of US are that anywhere between 2 to 3 weeks, if you are symptom free, you do not need to quarantine yourself anymore, and you're no longer considered contagious. And the recommendations are not to get the COVID test. But some of them places will require you to get a COVID PCR test, and it can be done after 2 to 3 weeks. My feeling is that you are no longer contagious. The CDC believes the same, that you're no longer contagious. So after 3 weeks, I think it is safe to assume that you've recovered from COVID, and you can go about doing your routine, things.
So my next question was actually that, if somebody is in isolation, how does one know that it is now safe to come out?
I
Can we
think three
safely
weeks is
say
a very
3 weeks?
safe. I think 3 weeks is a very safe time. Anywhere between day 16 to day 21 is the CDC recommendation. So I think by 21 days, I think it is very safe to say that you are okay to go out of quarantine.
Got it. Now, the other challenge is that the virus is known to affect the lungs, and people are getting their CT value checked. The CT. So, what
Right.
is the CT value, and what value is considered as alarming?
So yeah, so this is a very interesting thing which I'm seeing coming out of India, is that a lot of physicians are recommending, okay, you have COVID, go ahead and get your CT scan done. As a pulmonologist, as a lung specialist, my recommendation is not to get your high resolution CT, because it's unnecessary exposure to radiation, and it will not change the course of management. Like I've said before, 90% or more patients will be just fine doing routine symptomatic treatment at home, and they will not require, oxygen. So those cases, CT scan is not indicated. Uh, I would say CT scan is offered in patients who are not sure about the diagnosis, and I've seen a lot of people who've gotten all the symptoms of COVID, even low oxygen level, and they're COVID PCR tests are coming back negative. So as a confirmatory test, I think it is reasonable to get us high resolution CT. The other indications of getting CT scans are if you are having hypoxemia, meaning that if your oxygen levels are dropping down, or if you're having much worse symptoms, including having shortness of breath, I would say yes, go ahead and get the CT scan done to see what your lung involvement is. The CT scoring criteria, which is very commonly used in India, does not specifically correlate to severity of disease. I've seen some patients who have a CT scan score of 20 to 22, and they're totally asymptomatic, and I don't think nothing needs to be done differently in these patients as long as their oxygenation is stable. But at the same time, I've seen patients who have a CT scan of a score of 2 or 3, and they're on oxygen. So it does not necessarily correlate to the degree of disease. They call that they're seeing CT scan patches. Patches basically is what is the medical term for those are ground glass opacities, meaning that the CT scan, your lung tissue looks like there's a ground glass opacity in it, and just means that there is inflammation. If there is a lot of inflammation and you're requiring oxygen, the key of the treatment, the mainstay of the treatment is still the same, steroids. And if your oxygenation gets worse, or if you need hospitalization, things like remdesivir or tocilizumab can be offered to you depending on your clinical condition. So my recommendation in a nutshell is not to get CT scan unless you're having pulmonary complaints, meaning if you're having shortness of breath or oxygenation issue, because it will not gain anything other than give you undue anxiety.
Got it. Now, when you're talking of this virus affecting the lungs, it is said that they create some kind of patches there. And so, how does this virus affect the lungs in the long-term scenario?
So this is something which is still being studied. This is still not known how much of this lung tissue is going to affect, and what is going to be the long term long-term damage to your lungs. I'm seeing patients who have some long-term damage and still requiring oxygen, and I have some patients who just recover without any issues, and who are much more sicker in the hospital. So there is no rhyme and reason on to which patients will progress to a worse outcome versus which patients will not. Again, the key is that after you've recovered, make sure you consult with your physician. If you're still having issues with shortness of breath, we can offer some things called pulmonary function tests, where you sit in a small box and you breathe in and out to see what your lung inflammation is like. Those tests are done under the recommendation of a pulmonologist, and they can gauge if your oxygenation, if your diffusion capacity is affected by this virus, and what needs to be done. There are a few patients, and there are a lot of case reports coming out of the literature, that these patients are seeing some long-term lung damage. And again, there is no way to prevent it, no way to know which patients will progress or not. So it is basically just a routine follow-up and continuous monitoring of your symptoms in the long term. I would say in 3 to 6 months, if your oxygenation is fine, if your lung imaging is fine, you will most likely just do fine.
Got it. I've got two more questions before we start taking the questions that have been coming on the chat.
Sure.
One is that patients feel extreme weakness post recovery. Now, can they take medicines, or what is it that you recommend that these patients do?
Patients who have weakness and prolonged symptoms like just feeling lethargic. I'm seeing a lot of patients who have they describe their feeling as a brain fog. There is no treatment which is approved, and there is really nothing which is on the horizon also that will prevent from this to happen or even treat it. The mainstay still remains on symptomatic treatment, things as simple as very good hydration, taking paracetamol, crocin, Tylenol as needed, and ibuprofen, depending on what kind of severity of your symptoms are the main course of therapy.
Got it. Do you think there are going to be more mutants that will shock us in the future?
Absolutely. I think there is no way to prevent these mutations from happening. But the key is, the sooner we can vaccinate more and more people, the chances and the frequency of mutations will be significantly low. Once we reach a good threshold, around 60 to 70% of the population being vaccinated, there will be herd immunity, and this pandemic will most likely then be called over. Till then, we just have to fight it and be mindful and be vaccinated as soon as we can.
Got it. Dr. Ahuja, now I'm going to start taking questions that people have been putting on the chat. The first question that we got was, after how many days should one go for a CT scan?
So again, coming back to my explanation, the only reason you would go for a CT scan is if you're having issues with oxygenation, or if you have doubts about your COVID status. For sure, go for a CT scan if it's advised by your specialist. But my take on this is, the only indication is if you are hypoxemic, meaning if you're low in oxygen, if you want to see which way your course is proceeding, or if you're having hard time breathing, the CT scans are indicated. Other than that, those tests are going to give you unnecessary radiation exposure, and it will not change your management with what you're doing.
Got it. I'm going to club the next two questions. One is, what protocol of oxygen level is when the oxygen level goes below 94? And the second question is that, with the situation that we're facing right now, there is no space in the hospital. We are not getting oxygen support. What can be done to manage the situation at home?
So I think answering your first question, I think when your oxygen saturations consistently are below 92 and certainly below 88, that is when your oxygenation, supplemental oxygen support is needed. Usually the starting point of oxygen is anywhere between 1 to 2 liters of oxygen. You can start with that and monitor your oxygen with a pulse oximeter. And as long as your saturations are coming above 92 to 94 range or even more, you're good, that oxygen is working for you. There are a lot of oxygen delivery devices which one can get at home, including oxygen concentrators and oxygen cylinders. The major difference between the concentrators and the cylinders is that the oxygen concentrator usually can provide up to like 2 to 4 liters of oxygen, because it's basically the way the machine works is just converts normal air and increases the oxygen concentration. So you can, if you're requiring just a little bit of oxygen, oxygen concentrators are usually suffice well enough. But if you're requiring a lot of oxygen and you still cannot find a hospital bed, then you probably will need an oxygen cylinder, which can give you a more higher flow of oxygen. And certainly at that time, if you're requiring a more higher flow, I would say anywhere more than 4 liters of oxygen per minute. If you're requiring more than that, I would say that seek a hospital bed, because the chances of you getting worse are higher than the other people who are just on a little less oxygen.
Got it. Now, we have Simar who's asking, does the immunity go down for about 15 days once we take the first shot of vaccine?
Absolutely not. These are all misinformations going on. There is no data to suggest that your immunity drops when your vaccination is done. If anything, your immunity actually ramps up, and that is the reason why most of the people have symptoms like weakness, fatigue, low grade temperature, is that your body is developing and mounting an immune response. So if anything, it's a good sign that these vaccines are working. Now, it does not mean that if you do not get any of these symptoms, those vaccines are not working. It's not true at all, because every body reacts differently to an immune response. Some people have a more robust immune response, but some people have a silent immune response. So I don't think it is any different. I think the vaccine will not drop your immunity.
Now, Sharon asks, how long can I be infectious to others after testing negative?
If you've tested negative, you are not infectious anymore. Or if 3 weeks have been passed since your initial COVID positive PCR, you're no longer infective. As long as you have those two things, you're not considered infective. But that
Disha,
also does not mean that you can, since you've received COVID, since you got COVID, that you don't need to wear masks, or you don't need to practice, general hygiene, because you can still be a carrier of a fresh COVID infection and give it to someone. So that's why we still recommend that you mask up and do the routine things everyone else is doing, because you can still pass it on to someone else, and that also includes for vaccinated people. And a lot of people have asked me, okay, I'm vaccinated, why do I need to mask anymore? Because the reason is that you have to mask is that you can still give it to other people.
okay. The next question is, what when does someone need an oxygen concentrator rather than an oxygen cylinder?
So, like I answered in the past, I think the oxygen concentrator can give you um, um, a little oxygen. It's usually 2 to 4 liters it can provide. But if you're requiring much more higher oxygen, that's when you need an oxygen cylinder.
We have, if all members in a family are COVID positive, can they stay together or do they need to isolate separately?
I think they can stay together. I think there is no reason for them to quarantine alone if they're all positive for COVID, or even if they're having symptoms. So in a family of four, if two patients are tested positive, the other two are not yet tested, but they're having the same symptoms, it is very safe to assume that they're all positive and they can quarantine together. This pandemic has taken a big toll on mental health also, and I think it will actually be more counterproductive if they're all quarantining alone, because it's a lot of you have to make sure that your mental health is stable as well. So yes, you can quarantine together if you're all positive in the same household.
We have Rami asking, is it true that the smokers are resistant to corona?
Absolutely not. If anything, they're more higher risk for developing complications related to COVID, because their lungs are not healthy to begin with. There is a certain level of inflammation. They have comorbidities called COPD or asthma or chronic bronchitis due to smoking. So they're at a higher risk of developing more complications.
We have Saurabh Dua who's asking that his father is having fever for more than 10 days. What is your advice?
So this is, sadly, which we're seeing in a lot of patients, is that fevers go on to 2 to 3 weeks, and I'm having patients here whose fevers don't go down. I think the key here is the fevers can be treated symptomatically with medications like paracetamol, crocin, Meftol, ibuprofen. Only supportive treatment is needed. As long as your oxygenation is fine, the fevers can be treated very, just symptomatically and supportively.
So Toshit is asking that, there's been a recommendation that people should be wearing mask at home. Is it true that they need to mask at home even when they're sitting at a distance?
So I do not think, if you're just staying with your family and you're not like in a big community settings, there is no indication for you to, wear a mask at home, or if you're driving alone, uh, other than the legal perspective. From a medical perspective, I don't think you need to wear a mask just because you're sitting alone in the car. As long as you're all in the same household, you don't have to mask with each other. Those are the CDC recommendations.
Yeah. So Madhumita is asking, in fact, this is a very pertinent question because there's been a lot of social media rounds happening on this, that can nebulizers substitute an oxygen cylinder?
Absolutely not. Nebulizers are just machines which generate air vapor of the medication, the liquid which you put in. So it is basically just a form of nebulizing the medications, making it in a simple layman terms, in a water vapor form, so that you can inhale. That is not oxygen, and it cannot suffice for oxygen.
Okay.
If you require oxygen, if your oxygen saturations are dropping, you either need oxygen saturation concentrator, oxygen cylinder, or hospitalization, depending on your severity of symptoms.
So Disha's question is, how long should one wait to get a vaccine after recovering from COVID? I think you've answered this question. It was about 90 days. Is
So
it correct?
I don't mind saying that again. If you've received convalescent plasma as a therapy, the recommendation is 90 days. If you have recovered from COVID and you're out of the COVID quarantine requirements, you can get your first or second dose, whenever it's available for you.
Okay. We have another question where someone is saying that they got the first vaccine on 27th. When do I get the next one, considering the scenario today?
So I think whatever the recommendations of the manufacturer of the vaccine are, I think it's anywhere between 3 to 6 weeks, depending on what kind of vaccine you're receiving. Certainly complete your course, because 2 vaccines are the ones which give you the said immunity, depending on what manufacturer you're going with, and the chances of having severe symptoms being close to nil. So calculate according to the recommendations of the manufacturer, which is anywhere between 4 to 6 weeks, depending on different brands.
Got it. And Deepika is asking, what should be the protocol for kids less than 18 years when it comes to vaccine? And also, what are the protocol for prevention? Is a usual mask or hygiene levels enough?
Yes. So for kids, the good thing about this pandemic is that that the younger population, the children, the infants, the toddlers, are not seeing a much severe form of COVID. There are cases, obviously, and they probably have some medical problems, but for sure, general masking, hygiene, hand hygiene is the same. The COVID vaccines are not approved for patients less than 16 years of age in US and less than 18 years of age in India. Right now, the only vaccines which are which are being studied in youngsters are still not, data is still not out, so we don't know what the efficacy and safety profile is. So at this time, there is no indication, and it is not recommended that the kids or people less than 18 years of age get the vaccine.
Uh, so Konica and couple of other people have also asked that can people get COVID twice? Now, what's your take on this? And I've
So
seen that
there,
people are getting twice, but
right.
is it limited to
And I
twice
think
or can it be
this
even
is a
more?
lot to do with the variants and their vaccination status. Just having COVID does provide you some immunity, some antibodies to fight this, but it is still unclear to what extent it provides antibodies to the variants, and that's probably why they're having a second, a second episode of COVID. So you can certainly get COVID twice, and if even if you're vaccinated, you can still get COVID twice. The only thing is that the chances of you having a worse outcome are lower.
Okay. Vinay asks that I have 400 plus antibodies. Can I still get corona?
So I'm not sure what that means, having 400 plus antibodies, because most of the tests are not quantitative, they're qualitative, meaning that they can tell you that, okay, yes, you have COVID, or you have COVID antibodies, or you don't. So I don't think there's an absolute number to say, okay, you have these many antibodies, you can get COVID or not. And the COVID antibodies does not necessarily protect you from different mutations or variants. So there is no absolute immunity anyone can get right now till we uh, reach herd immunity.
Okay, we have Toshit asking that once a person has been cured of corona, he's recovered from corona, should he be getting the chest X-ray done?
So if before, during COVID they had CT scan changes of having COVID or worsening CT scan changes, then the recommended time frame to repeat a chest X-ray or a CAT scan, and again on the recommendation of the physician, would be anywhere between 8 to 12 weeks, because that's how long it takes for your lungs to recover.
We have Gaurav Sareen who's asked, can you confirm if ivermectin, I'm not able to pronounce it properly.
Ivermectin, right?
Yeah, ivermectin is actually helpful since it's being widely prescribed by doctors in India.
There is no data to prove and support the efficacy of ivermectin. I do not recommend that routinely in patients with COVID. It's an antiparasitic medication. I'm not even sure why it was studied for COVID in the first place. There was some mechanism of actions which potentially could be virucidal, basically meaning decreasing the viral load. But those studies were done in lab populations and in higher concentrations. Right now, ivermectin is not approved, and it is not routinely used for any treatment of COVID-19.
Okay. We have Gurpinder Vora who's asking, we had COVID a month ago, have recovered. I got my antibodies test done. It's positive at 5.7. When should I get my first jab done?
So once you have recovered from COVID, as long as you did not receive your convalescent plasma or any monoclonal antibodies, you can get your vaccine as long as you're out of the quarantining requirements.
Okay. We have Dhruv Bhatia who's asking, can CPAP also be used for oxygen?
It can be, as long as there is an oxygen connector to the CPAP machine. There are some CPAP machines you can attach and hook up an oxygen connector, so that can be used as an oxygen delivery device. But usually simple CPAP machines without an oxygen input will not provide you a higher level of oxygen.
Vinay is asking if you do consultations from India.
Sure. I mean, reach out to HealthFAQ, and Harbinder will be happy to connect me to everybody. I'll be happy to help.
Okay, we have Vinay also asking, what is a good antibody count? Does higher uh,
Yes.
mean less prone to reinfection?
There is no absolute number for the COVID antibody testing where you can say that this is, that you're immune. Because of the variants currently prevalent in India, there is no absolute titer. Having a positive antibody test does not make you immune. Your chances of getting COVID are less, but that does not make you immune. So be very mindful of that. And does just that because you had COVID in the past, or if you have antibodies, does not mean that you're immune, because there's a lot of variants going on right now.
We have loads of questions coming in when it comes to Fabiflu. So what is your take on this medicine, Fabiflu?
So Fabiflu is also, it was studied out of Japan. It is not approved in the US because the studies did not show a significant reduction either in the viral load or in treatment, or decreasing hospitalization, or decreasing the chances of requiring oxygen. So usually it is not indicated routinely in patients with COVID.
Okay. We have Arvind asking that he has 99 fever for the last 3 days. Just headache. And is it safe for him to carry on taking paracetamol?
Absolutely. Just monitor your symptoms, and if your fevers are consistently 2 to 3 days still not coming down, I would say that get yourself tested for COVID.
And Saurabh is asking, what is your take on favipiravir tablets? If the doctor recommends, for how long should you be taking that?
So it's the same thing. The Fabiflu and the
Flu
Favipiravir are exactly the same things, and my recommendation is that right now it is not recommended for the treatment of COVID.
Okay, we have Ayesha. She's asking a question which is actually being discussed quite frequently, which is, what do you mean by that the infection is in the air? Does it mean that you can't go out in your balconies, or you need to be in closed doors?
So it's an airborne virus, but that does not mean that if you're walking in your balcony that it's in the air and you will catch it. It's not possible to catch COVID just by being in your balcony. It's usually prolonged contact with someone who has COVID or has air droplets within a close proximity. That's why 6 feet recommendation is there. It does not mean that there's just breathing air will make you have COVID. It is not true, and it's not proven.
Okay. Toshit is asking that his son had only the two symptoms that he had was that he had no smell or taste sensation. Could it be COVID? But there's no fever, nothing else.
So I think the loss of taste and loss of smell are very, very characteristics of COVID. Most of the patients are either asymptomatic and having these kind of symptoms. So if you have lots of taste, loss of smell, and this during this time, the chances of you having COVID are pretty high.
Okay. I'll take two more questions before we end the session. One is Sophia is asking, my mother is taking a nebulizer for asthma and Kiowa puff for over 5 years as her lung capacity is very weak.
Mhm.
What preventive medicine precautions should she take for her own safety?
So there's no preventive medications you need to take. Obviously, she's at a higher risk for developing, COVID-related oxygen complications. But I think if she continues to follow the universal masking protocol, hand hygiene, and avoiding outdoors or unnecessary, contact with people, I think you will be fine. Again, there is nothing to prevent itself, per se, for COVID to happen, unless the only thing you can do is hand hygiene and masking, and there's no medications you can take preemptively to prevent the severity of the illness.
In continuation to the question that you answered earlier about COVID being in the air, Vinay is asking, is it safe to be running on the road when the roads are empty?
Yes, it is safe. As long as the roads are empty, it is safe. Make sure you have a mask with you. If you come across a lot of people, make sure you mask up and just be safe.
And what if the second dose of Covishield, which is one of the vaccines, is delayed beyond 8 weeks?
As per the vaccine manufacturer recommendations, if it is delayed beyond 8 weeks, I believe that you have to start the course all over.
Okay. My last question to you is, my antibody test shows 0.26.
I'm sorry, can you repeat the question?
Sorry, my antibody test shows 0.26. Do I have antibodies to fight COVID?
So again, yes, you do have antibodies to fight COVID because your antibody test is positive. Again, the number in my personal experience and opinion does not matter what the number is. If you have antibodies, you have antibodies to fight it, but that does not mean that you will not contract COVID because of the variants going on. Does not make you immune to other variants, does not make you immune to a more aggressive strain of the same COVID. So that would be.
I'm sorry, the questions are flowing in. I'm going to take 2 more questions if it's okay with you.
Sure.
Yeah. After the first dose, the person is COVID positive. When can he take the second dose?
So after the first dose, if the patient becomes COVID positive, the recommendations are to finish their quarantine requirements as long as they have not received COVID plasma, the convalescent plasma. They can get the second shot of COVID vaccine once their COVID quarantine requirements are over.
Got it. And the last question is, what is the difference between CPAP and BiPAP?
So basically, CPAP is a continuous pressure airway, a continuous positive airway pressure. That means CPAP. It's a delivery system for patients who have obstructive sleep apnea, and it's basically a tighter mask which either goes around your nose or your mouth, and it provides a continuous positive pressure. The other mode is called BiPAP, or what we see in the hospitals being used is called the non-invasive ventilation or BiPAP, and it actually provides a higher pressure and a lower pressure, and it is shown to help some people avoid mechanical ventilation. CPAPs are not usually used for COVID. BiPAPs are recently being more used for COVID.
Great. Thank you so much, Dr. Jaspreet. It
No
means a
problem.
lot for you to take out time from your busy schedule. I know you're headed to the hospital after this. It means a lot to us and all the people who've joined us for this session. I really, really, really appreciate your taking
I'm
out
happy
time.
to help.
Thank
Thank
you so
you.
much.
Thank you. Bye.
Bye.